So let's go back to this idea of metabolic syndrome, because I'm a little bit understanding, but some people, when you say those words, metabolic syndrome, what are we actually talking about?
Essentially, it's a insulin resistance or elevation of this fat storing hormone insulin, and it causes elevations in blood glucose, blood pressure, waist circumference, triglycerides, and it causes a low good cholesterol or HDL. And essentially, if you have 3 of those 5 constituents, you are considered to have metabolic syndrome, which about 40% of Americans currently have.
Right. And it's a growing issue, correct? It's something that we're seeing more and more of, at an exponential rate.
Well, it absolutely is. And the scary part is you can be thin, right? You can look great on the outside and you can have really bad metabolic health. So you can't just look at yourself in the mirror and say, well, I'm a thin person, I'm healthy. In fact, a lot of times, especially people who are sort of like a Asian Indian descent, they typically are thin on the outside, but are fat on the inside, essentially storing fat in and around their organs.
Right. And I remember reading that it isn't one of those things that's so obvious, I feel like, anymore, that a number of people do have issues that they're not aware of. And this is part of the reason also I felt that when a lot of people were saying, well, it's affecting also healthy people, are we truly saying these people are healthy or not is a question that we need to raise somewhat. But beyond that, there are, of course, other actions you put in your book for metabolic beyond the nutrition. One of those things you talked about, which I know you're a big fan of, is the sauna. Now, you're using an infrared sauna every day. Can you go into that and what heat kind of therapy and why that is important to the immune system?
So essentially, over the past 500-600 million years, mammals have evolved a first-line defense against infection, which is essentially a fever. And we've evolved this way to secrete these sort of proteins to help us out during infections when we raise our core body temperature. These are essentially heat shock proteins. So you can sort of mimic the benefits of a fever by sort of prophylactically going into the sauna, 4 to 5 times a week and stimulate those heat shock proteins. That way, if you do have an infection, right, the heat shock proteins can act right away. And so how this works is in order for a virus to replicate, it has to first infect your cell, take over the machinery, and export itself out. So inside the cell, there's something called a viral ribonucleoprotein complex. And a protein called M1 protein has to dock onto that complex in order for it to be exported out. Heat shock protein 70 can bind to that complex and prevent M1 protein from binding, preventing viral export. So we have good mechanistic data on how sauna works. And if you heat shock animals before you give lethal influenza like H5N1 bird flu, which was the cause of the 1918 Spanish flu, you can dramatically reduce mortality, lung pathology, and viral replication. And we've seen, even in a clinical study in humans, that people who get sauna sessions multiple times a week are at about a 50% lower risk of getting the common cold compared to people who weren't getting sauna sessions.
That's really interesting. And I know a lot of discussion right now is also about cold therapy. And I think in your book, you said the research isn't as strong as it is with heat therapy. So, you have a lot of these people, Wim Hof and others doing these ice plunges. What does the data and research show about that as it is directly correlated to immunity and, and infections?
So essentially, if you are sick or you're sick and you don't even realize it, the last thing you want to be is cold, because it's the heat that many viruses, particularly RNA viruses, are sort of susceptible to. So it's interesting that RNA viruses have very little weakness, but one of their weaknesses is heat. And so if you can raise your core body temperature just to the level of a fever at about 102, which can easily be hit in a sauna, that's going to significantly release those heat shock proteins, which have antiviral effects. And not only that, viruses simply don't even replicate as well at an elevated temperature above your core body temperature. Now, if you are healthy and you're not infected, doing cold plunges can release cold shock proteins, and that may sort of make your own cells more resistant to other stressors through hormesis. So I'm not saying that cold plunges or cold therapy doesn't have benefit, but definitely things like sauna and heat shock proteins have more evidence than cold shock proteins when it comes to the immune system.